Low sexual desire, understanding the quiet shift in intimacy. Desire is one of the most powerful forces in relationships, yet it's also one of the most misunderstood. There is no universal normal when it comes to sexual appetite. Every person carries a unique rhythm of arousal, and even that can change over time. A partner who once felt an irresistible pull toward intimacy may suddenly feel distant. A couple who once couldn't keep their hands off each other might now go weeks or months without touching. This is not unusual, it's human. But what happens when low sexual desire creates distance, confusion, or even conflict? When one partner wants more and the other wants less, it can leave both feeling unseen, unwanted, or rejected. Psychologists call this hypoactive sexual desire, and while it's not always a disorder, it becomes significant when it affects self-worth or the health of a relationship. Why does sexual desire change? Desire is complex. It's not just biology, it's psychology, history, culture, and relationship dynamics. Stress, fatigue, depression, medications, poor body image, or a demanding lifestyle can quietly erode arousal. Unresolved conflict, resentment, or even boredom in long-term relationships can dampen the flame. And past experiences, such as trauma or strict religious upbringing, may shape how a person views intimacy, sometimes layering shame or fear on top of desire. For men, testosterone levels, stress, and performance anxiety often play a role. For women, desire can be more situational and emotional, linked to feeling understood, attractive, and safe. Understanding these nuances is essential. Low desire rarely means someone is broken. Signs of low sexual desire: a lowered sex drive can appear in many ways. Lack of response to a partner's advances, little to no sexual fantasy or interest. Difficulty with arousal or erectile issues, anxiety around sex. A sense of obligation rather than excitement. What's important is not to measure yourself against others but to ask, is my level of desire causing me distress? Is it affecting my relationship? When desire feels uneven, one of the most painful realities for couples is mismatched desire. It's not always about rejection, it's often about timing, stress, or emotional connection. Many partners unknowingly hurt each other by avoiding conversations about sex, letting resentment grow. Yet open dialogue can transform frustration into intimacy. Saying "not tonight" doesn't have to hurt if it comes with reassurance and an effort to reconnect later. Treatment and renewal. Good news: desire can be rediscovered. Counseling can uncover hidden resentments, power struggles, or emotional wounds that block intimacy. Addressing depression, improving self-image, and reducing stress are often key. Mindfulness techniques, sensate focus exercises, and simply spending time nurturing non-sexual closeness can reignite arousal. For women, education about how desire works, responsive versus spontaneous arousal, can be empowering. For men, medical checks for testosterone, medication reviews, and stress reduction strategies can help. And for both, playful curiosity, slowing down, and allowing intimacy to unfold without pressure can be transformative. Age and desire. Libido naturally changes with age, but desire does not have an expiration date. Physical health, emotional closeness, and an open mind matter more than years on a calendar. Some older couples find that intimacy becomes deeper, more creative, and less pressured, even as frequency changes. The happiest long-term couples share one belief: passion takes tending, not waiting. Low sexual desire is not a failure, it's a message. It may signal stress, misalignment, emotional distance, or simply a need for new energy. Instead of seeing it as an ending, it can be an invitation to learn, to talk, to heal. The key is honesty, curiosity, and the courage to explore what truly stirs desire for yourself and with your partner.